I'm talking about the credibility formula. We're talking about the competency element right now. We talked about honesty, competency. We're going to talk about caring next. But right now we're looking at the competency component. So competency is, can you actually deliver the goods? All right, we've already addressed that you're an honest person, and that's great. But now, does this patient feel like you can truly do what you say you can do? Do they think that you can actually give them the dental work or the dental care and have it work well? Is it going to look good, feel good, and last a long time? Is it going to kind of meet those three basic clinical elements for them? And so they're looking at you and wondering, are you competent? So how can you convey competency? Well, one of the best things to do is you just simply have to start with being confident in yourself. I mean, confidence is going to come with time. It's going to come with doing a lot of procedures. It's going to come with going to CE courses and being involved in your career, reading the trade journals. I mean, trying to keep up with all kinds of things going on in your career. I mean, you can look at how you want to spend your time. Do you want to spend it watching movies and sports on TV, or do you want to be developing your career? Because the more you develop yourself with your career, the more you can walk into the room and be able to have authority and speak with confidence about what the treatment needs to be. And patients can sense when you are kind of on the ball, when you are confident in what you're doing. That's going to translate into, again, that competency, into credibility. And so what are some of the things you can do? Okay, so I already mentioned kind of briefly, it's coming down to your confidence, and that comes through experience. There's other things you can do within your office, and that is, let me refer to my notes. With this, you're going to have to give the same treatment presentation for several different things. You know, a cracked tooth, deep decay, possible root canal, replacing a missing tooth, moving teeth with braces versus Invisalign. There's so many different things that we do in dentistry, and so people come in and you have to explain this to them. You could have your little spiel put together. So one, it's going to make it very efficient. And two, when you kind of have it down, you kind of worked it out so it's going to be at its most optimum. When you can deliver that without talking in circles or using a lot of filler words or waffle words, those are kind of those maybe someday you might think about. I mean, when you come in and you're very direct, not domineering, not overbearing, but just being very clear about what you're saying, and you've kind of rehearsed what you're going to say, that plays into patients feeling like you're very confident and hence competent in what you're doing. You can also have something like a little tactical thing is, how about you put your diplomas and your certifications and all of your different CE courses, you get the little nice printout. You could put those up in your office. You don't need to have them in your private office like this. You don't need to have them, at home. You just need to have them where patients can see them, when they can see that you have actually gone to school, that you've actually gone above and beyond, where you've taken CE courses or you've completed some kind of training institute program. If they can see those things, that kind of adds to your resume, if you will, of your competency. Of course, you have this stuff in your office, you're going to also have it online. You're going to have it on your About Us page of your website. You're going to have it on your Facebook or your Instagram or any other social media thing where people could look you up to see if you're the real deal. They can see that you're actively involved, that you are really doing quite a bit for your career. They're going to feel more comfortable putting their care into your hands. What about also this? Having a clean office. Now that may not translate directly to you, but if the place they're going into is a mess, or if it's cluttered, that translates to you. I mean, that's also like how you dress as well. If you're kind of sloppily put together, they're going to translate into, if you're sloppy with your dress, you're probably sloppy with your work. If your office is dirty, then they're going to wonder about how clean the procedure is going to be for them. And it doesn't matter if you're renting the place or if you're an associate, it doesn't matter. Your environment needs to be clean. Your future depends, or your career depends upon it. So it needs to be cleaned up. It doesn't matter whose job it is. It doesn't matter if the maintenance crew or the janitor or whoever, didn't do it. You got to do it, or you got to get somebody in the office to do it. Somebody has got to get this place cleaned up and decluttered so that it has a more welcoming and more an environment for these patients, that they feel like you're coming into a clean, professional, well-run office. And so getting that taken care of is going to be part, again, of the whole confidence and competence part. Of course, you could also have before and after photos. You have to get yourself a high quality camera, a nice DSLR, or they have mirrorless cameras now, where you're going to take some nice before and after clinical pictures. These are great things to put on your website. Patients are going to check out your website. They want to see your work. You maybe have a portfolio of your before and afters. They're going to want to see that. You can also have that up if you can do it in a tasteful way in your office. That would be very helpful to have patients see the kind of work that you're doing. When you're actually treating patients, when you're taking photographs, explain to them that you're doing this for record keeping, for their chart, of course, but you're also doing it for a teaching thing you're going to be doing. Now, your teaching thing could be an online course, it could be a YouTube video, it could be submitting something to a trade journal. It could be you're going to be part of an institute or part of a study club. There's reasons why you could be gathering this information. When patients feel like you're doing something more than just doing the dental work, that you're actually documenting the work, they're going to feel much better about the work you're doing. But also it kind of builds on the word that, hey, yeah, my doc, yeah, he or she's really good. She's actually, or he is actually a teacher, or does some instructing. I mean, you may not be an instructor at a dental school, but they know that you're doing some kind of teaching to the general profession. So taking before and after pictures and explaining why you're taking them, I think that goes a long way in helping the patients see that you are a credible person. And so I mentioned you can have these things posted on your website, and I kind of talked briefly about social media. Yes, people look at social media. They're going to do trolling for you on social media. So having your stuff up on Facebook is where you need to put it. Facebook, we all think that's where we put pictures of our kids and so forth, and we do, but it's also for work. You put your career stuff on Facebook, on Instagram. That's where you're hanging out. Some people just want to keep their social life social and want to keep their business life personal or business life professional. But no, they are intermixed. When you are a dentist, it's you. You're the dentist. You're the one that, whether you're there working or not, they're going to see you as a person who is in their career. And so what you post online is going to be a representation of who they think they are seeing. And so if you just have non-dental things, if they're just personal things, that's fine that they see you have probably a family or that you're involved with things, but if you can put professional things on there as well, they're going to see that this is kind of you. Being a dentist is you, and they're going to see that as being someone who's really into their profession, and hence they're confident. They're confident and they're competent. So hopefully these ideas were helpful. We got the next one coming up, and that is caring. Hopefully that's been helpful, and look forward to showing you guys the next video, which is going to be on caring.